Prognosis for breast cancer in particular, I find is very difficult to estimate. Let's say you go and watch a thriller movie in the cinema. You go there and you sit for 2-3 minutes. You've got absolutely no idea what is going on. You sit there for half an hour and slowly the movie you start to understand, and you may try and predict what might happen next. When I initially see somebody with breast cancer, advanced breast cancer upfront, I tell them what we see now is a snapshot in time. It only tells me you've got breast cancer, it only tells me what is the burden of the disease, and it only tells me what type of breast cancer it is. We do not know how you are going to handle the treatment, and we do not know how the cancer will spread. We do not know if you will have any complications. We do not know how willing you are to have treatment, and we do not know, most importantly, how your cancer is going to respond to treatment. Eventually, it is not a disease where patients will live forever, but the variation could be as much as from 1 year to 7-8 years. So again, the law of the average is nobody meets the average, and I don't know if you guys have ever seen the graphs for the averages. So if we look at any average for anything, we are quoting you this number, the middle one. But there are people, so that's just the 50%. 50% will do worse than the average, 50% will do better, 50%, 2 to 3% will do extremely poorly, and 5% will do really well. And when you see a patient at this time point, then you do not know whether their cancer is going to go like this, like this, like this, or it will shrink really nicely, then stay like this, and then grow, and then. So I've had patients, I given them chemotherapy, and after chemotherapy, their cancer hasn't come back for 3 years. They are just on hormone tablets and bone strengthening drugs. I've had patients, I've done the same thing for similar cancer for another patient, it's come back within 6 months. So obviously, these are such different scenarios. And I've had patients with secondary breast cancer who stopped having treatment after 10 years because they said to me they've got survivor fatigue. So it is very difficult to estimate, but general rule, breast cancer is much more treatable than other cancers. There are usually more treatment options than in other cancers, and often the patients we see are a bit on the younger population. So like often I would see prostate cancer patients, they would be more like in their 75, 80s. So there isn't a lot of strong treatment you can give, whereas a number of breast cancer women would be in their 40s, 50s and 60s. They're often in good health, and so you can often give a number of treatments. And then the other thing is new drugs keep on coming. So how do you account for that in the outcome? Like, just give you an example. About 7-8 years ago, as an oncology trainee, I used to work at the PA hospital, and nobody wanted to see melanoma patients because there was no treatment you could give. And now everybody wants to see melanoma patients because they are on immunotherapy, they keep going for many years, and they hardly get any side effects. So you used to do breast cancer clinic and melanoma clinic, and breast cancer clinic was easy at doing at the PI than the melanoma, and now melanoma clinic is easier than the breast cancer clinic, and it's only what, 7-8 years. So things have completely changed. And then in breast cancer, obviously 10 years ago Herceptin came, and then for secondary breast cancer everolimus came few years ago, Afinitor, some of you may have been on it, and then newer hormone tablets, they got released last year, palbociclib, and then the other hormone tablet got released, and the data came out at ESMO this year. So as new drugs come along, the graph keeps on shifting. And I often say to the patient is it is about what you want to achieve from your life. You can live your 10 years of life in your 2 years or 3 years you've got, and leave me to deal with the cancer and you lead your life. Obviously, there are times when it is going to be challenging, but when you get time, you make most of what you've got.